In 2020, Western Equatoria State had the highest new HIV infection rate, followed by Eastern Equatoria State. Flora Alfred, the HIV state coordinator, says the major challenges include stigma and fear, which prevent patients from picking their prescription drugs, ARVs, which can give HIV patients normal lives. Flora says some counties such as Kapweta and Magwi registered high rate of HIV infection in 2023, but she says the situation is changing gradually.
HIV in Eastern Equatoria is 1.9. Before it was 3.6. The Eastern Equatoria became the second to the Western Equatoria. But now the rate is dropping down because we have people who are working there. They are really well equipped, and also the clients who are taking drugs, they adhere also to the treatments, and the viral loads is now suppressed. That is why you can see now the HIV is coming down. And in the community index test, it really reduced the rate of the HIV. And we have partners who are working here. They really also helping the government.
Innocent Rosetta lives with HIV/AIDS. She says many people who are HIV positive face discrimination and some hide their status.
I may have a friend that I tell my status, and later she or he will also go and tell other people. Then people will start saying, we don't want that person to sit with us. She is sick and she will infect us. They start to finger point you. After hearing that, you start to fear to attend meeting in the community because you fear to be finger pointed. And this stigma brings a lot of pain to the person infected. This sickness does not kill if you follow the doctor's prescription. But the problem is the stigma in the community sometimes can make you refuse to take drugs and just want to die or hang.
Achola Evelyn is a former volunteer and HIV/AIDS counselor at the State HIV/AIDS Commission in Torit. She says she had been living with the virus and urges residents of Torit to check their status.
Hospital is the best. Any sickness you feel, go and know your status first. Or you have malaria, typhoid, tuberculosis, what. Go in the hospital. We leave the issue of juju. Which doctor? Like right now, the crisis, the one is there. As right now, you got a ladies, they are running away from home. From 15 years, 13, 14, 16, they go out from home because anger, because what? Now they are on the street. In the evening, you get a man who is able to go with the girl. Maybe the man is positive.
Rose Robin is another living with HIV/AIDS. She says residents of some Eastern Equatoria community know little about HIV/AIDS.
In Himodonge, we went there for awareness. When the community saw us, they asked who we were. And we told them, we are people who come to tell you about HIV/AIDS. They start chasing us until the chief came and stopped them. And we continue with our work. Later they come to listen and some tests after the awareness. Also, to the next village was the same thing. That's the challenge we face. Others says that people with HIV are thin and unhealthy, but these one are healthy. How? In the community, there are a lot of challenges. If they know you are sick, they separate you from people and even give your food separate.
HIV/AIDS remain a major public health issue in South Sudan with varying infection rates across the country. According to the United Nations Population Fund, the HIV prevalence rate among people aged 15 to 49 is estimated at 2.4%. That would equal about 194,000 people living with HIV across the country. For VOA News, I am Kaltuma Vanesa in Torit, Eastern Equatoria State.